Good morning, everyone. Welcome to CCPU Healthcare webinar. We will be displaying an English-Spanish version of the presentation on the screen. To access this presentation in Chinese, please visit the ccpuhealth.org/resources and select the presentation. You can also download the English/Spanish version of the presentation from this page of the website. Good morning. I'm Horst Turner, a family child care provider from Stanislaus County. Because our event is translated into multiple language, we remind all speakers to speak slowly. If you're using the computer, follow the instructions behind me to access the presentation in the language other than English. Upon entering the webinar, you will see a globe icon on the bottom of the screen. Select this icon to access the interpretation feature and change the audio language. You can switch between the languages at any time by using the globe icon. While using the interpretation feature, you can choose to hear only the interpreter or to hear the interpreter and much more faintly of the original speaker. If you wish to listen to the interpreter only, select the globe icon and select Mute Original Audio. If you're using the Zoom app or a smartphone or tablet, look for the three dots on top or bottom of your screen. Choose a language interpretation. Then choose the preferred language option. Finally, select Done. You can switch between languages at any time during the webinar by following these same steps. This is our program agenda. Today's presentation will be describing our new CCPU Health Care Fund. We will review how the fund works, who's eligible, and how to become eligible, fund benefits and how to apply. We'll also have time for questions at the end. All right, let's talk about how the fund works. During this presentation, scan the QR code on the screen with your smartphone to access the ccpuhealth.org for more information. Now, I'm excited to share this. The CCPU Healthcare Fund website, is available in English, Spanish, Chinese, and Arabic. So let's get started. The CCPU Healthcare Fund is a healthcare trust governed by a board of trustees. We work for you. Currently, medical insurance plan to reduce or in some cases eliminate your out-of-pocket expenses, healthcare expenses. In short, the fund was designed to save you money. The expenses, we can help with out-of-pocket costs for Medicare and prescription drugs, including copays, deductibles, and monthly premiums. As you know, these expenses can be quite costly and can add up over time. So receiving a reimbursement like this for things like doctors' visits leads to incredible savings. So how did we get here? As you may have heard, after challenging the collective bargaining between the state of California and CCPU, the state agreed to provide $100 million annually to help eligible child care providers reduce or eliminate the healthcare expenses. This $100 million is what we're using to reimburse you for your eligibility expenses. What's a CCPU Healthcare Fund? Isn't. One of the things to keep in mind that CCPU Healthcare Fund is not a health insurance plan. It does not provide medical insurance, and it does not replace your current healthcare plan. So if you have healthcare insurance, you should not cancel it. In fact, you cannot enroll in the CCPU Health Care Fund unless you're enrolled in a qualified health insurance plan. But you're not insured, don't worry. You can enroll in a qualified health insurance plan and then receive your reimbursement from CCPU Health Care Fund. For help enrolling in qualified health insurance plan, please visit ccpuhealthcare.org/help/enrolling. Now let's talk about who's eligible. These amazing benefits. The CCPU Health Care Fund is available to providers who meet all the following. 1, you must be paid for working with a subsidized child. 2, you must enroll or be enrolled in a qualified health insurance plan. 3, you must enroll in the CCPU Healthcare Fund by completing the CCPU Healthcare Fund application. So let's discuss each criteria in more details. To start, you must be paid to work with a subsidy childcare. A subsidy child is a child from whom a family receives government assistance, sponsored financial assistance, expressly intent to pay for childcare. For providers, that means their fees are carried for childcare is reimbursed in whole or in part, a government assistance program. The subsidies must come from a qualified state program. Local, county, funded assistance programs do not count towards qualifying the benefit. To first become eligible for the fund benefits, you must work with a subsidy child for 3 out of 6 months to continue being eligible for the fund. You must be paid to work with a subsidy child 1 month of 3 months. So let's do that again. You must be paid to work with a subsidy child 1 month out of 3 months. Visit the ccpuhealthcare.org for details on how paid work eligibility is determined. Enroll in qualified health plan. Second, you must be enrolled in a qualified health plan. Qualified health plan includes those offered through Covered California, Medicare, employer sponsor plan, Medicare, Medi-Cal, and Medi-Medi. Veterans Affairs health care benefits are TRICARE. Fund benefits are available for every provider, regardless of the type of qualified health plans they have. And I like to mention earlier, if you're unsure, there's no need to worry. Visit the ccpuhealthcare.org/help enrolling for enrolling in a qualified health plan. You must apply to the CCPU Healthcare Fund. Third, you must apply to the CCPU Healthcare Fund by completing the CCPU Healthcare Fund application. Completing the application requires just a few simple steps. Step 1, complete your personal information. Step 2, fill out the information and currently health plan. Step 3, upload your proof of coverage documents. Step 4, review your information and submit. How to apply? To apply for the program, visit ccpuhealthcare.org and select the application. To complete a paper application, instead of applying online, call the fund customer service line at 833-714-0000 833-714-6028. Once again, that number is 833-714-6028. Paper applications will not be processed as quickly as online applications. Please note, the call center is not open during the weekends. You can watch a video demonstration of how to apply on a YouTube channel available on both English and Spanish. And now I'd like to pass the baton on to Joe. Thank you.
Good morning, everybody. Today I'm going to be going over with you reimbursements, how the reimbursement system works, among some other things for my part of the presentation today. So once your application is approved, you will be sent a CCPU Health Care Fund debit Visa card to pay for the eligible expenses. Now, keep in mind, this is not a credit card. You won't be sent a bill. This being a debit card means that when you use it, the fund is paying directly for your eligible healthcare expenses. Your CCPU debit card works like a regular debit card, except that you can only use it for covered medical expenses based on your health plan. You can't use your card in an ATM or to get cash back when making a purchase, and you will not receive monthly bills, and there is no interest to pay. You can also request a reimbursement for an expense you paid with your own money. Let me just repeat that. So you can request a reimbursement for an expense you paid with your own money, in addition to using the debit card. When your application is approved, you'll receive login instructions to access our secure online portal and a guide that explains how to file a request for reimbursement. Reimbursement for out-of-pocket expenses and health insurance premiums are not considered taxable income. Again, I'm going to repeat that one again. Reimbursement for out-of-pocket expenses and health insurance premiums are not considered taxable income. So set your mind at ease on that one. Now, in these next few slides, we'll review the specific benefits available to providers who are enrolled in a qualified health plan. As a reminder, these are health plans available under Covered California, Medicare, an employer-sponsored plan, Medi-Cal/Medicaid, VA healthcare, or TRICARE. If you don't have health insurance coverage now, we'll also cover how you can find and enroll in a qualified health plan. Now, for providers enrolled in Covered California, the fund will reimburse 100% of your health insurance and premium and cover up to $8,750 per year in health plan expenses. This includes reimbursement of out-of-pocket medical and pharmacy expenses such as copays, deductibles, and co-insurance. Fund benefits are only available if you are enrolled in a silver level HMO plan. Again, I'm going to repeat myself. Fund benefits are only available if you are enrolled in a silver level HMO plan for Covered California enrollees. If you have a second job that offers health insurance, you are not eligible for benefits from the fund if you have insurance through a Covered California plan. You are only eligible through that employer's health insurance plan. Now, for those of you enrolled in Medicare, the fund will pay up to $8,750 per year in eligible health plan expenses. This includes reimbursement for out-of-pocket medical and pharmacy expenses, such as copays, deductibles, and co-insurance. Medicare expenses also include reimbursement of Medicare Part B premiums up to $164.90 per month, and Medicare Part D premiums up to $50 a month. Again, it will cover Medicare Part B premiums and Part D premiums up to the limits on the slide. Now, for providers who have a second job that offers employer-sponsored health insurance, the fund will reimburse your health insurance premium up to $100 per month and cover up to $87.50 per year in health plan expenses. Again, if you have a second job that offers employer-sponsored health insurance, your premiums will be reimbursed up to $100 a month, and you get the standard $8,750 per year in health plan expenses coverage. So if you have a second job that offers health insurance, you must be enrolled in that plan to receive fund benefits. You will not be eligible for fund benefits if you enroll in Covered California. If you have access to an employer plan as a dependent through your spouse, you can enroll in either the employer plan or a qualified Covered California plan and receive fund benefits. For those of you who are enrolled in Medi-Cal, the fund will cover $100 per month for permissible health care expenses. Permissible healthcare expenses include braces, glasses, aspirin, etc. This benefit is different from other qualified health plans because Medi-Cal often pays 100% of premiums and out-of-pocket expenses. The permissible healthcare expenses benefit is only available to providers who are enrolled in Medi-Cal. It is not available to providers who are enrolled in one of the other qualified health plans. Now, for those of you enrolled in Veterans Affairs healthcare benefits, the fund will cover up to $8,750 per year in eligible health plan expenses. This includes reimbursement of out-of-pocket medical and pharmacy expenses such as copays, deductibles, and coinsurance. For providers enrolled in TRICARE, reimbursement benefits differ by plan type. For providers enrolled in TRICARE Prime, TRICARE Select, TRICARE Reserve Select, and TRICARE Retired Reserve, the fund will reimburse your health insurance premium up to $100 per month and cover up to $8,750 per year in health plan expenses. For providers enrolled in TRICARE for Life, the fund will reimburse your Medicare Part B premium up to $164.90 per month. Now, for providers who don't have health insurance, the fund can refer you to an enrollment specialist who can help you find an appropriate qualified health plan. Based on the health plan you are enrolled in, you will receive the fund benefits we just reviewed. Please visit ccpuhealth.org/help-enrolling to get started. The agencies listed on this webpage are approved by Covered California to assist you, and they also know about CCPU's Health Care Fund. With the fund's assistance, every eligible provider has access to affordable health care with up to 100% coverage. So if you need more information, because we just threw a lot of it at you, or you need clarity on the information you've already been provided, please visit our website at ccpuhealth.org and sign up for updates via text or email. You can also email support@ccpuhealth.org. Again, that's support@ccpuhealth.org, or call 833-714-6028 to speak with a customer service representative. The call center is open from Monday through Friday, 8 a.m. to 5 p.m. Pacific time. Now, this concludes my portion of the presentation. I'm going to turn it over to my colleagues, Brenda and Heidi, to talk a little bit more about the union CCPU.
Hi, everyone. My name is Brenda Jackson. I'm one of the organizers with Childcare Providers United. And I have here with me one of our provider leaders, Heidi Escobar, who's going to give a brief presentation about our union, what we fought for, and why you should join Childcare Providers United.
Good morning, fellow brothers and sisters. I would like to start off with talking a couple of important news and updates. At the end of 2019, Governor Newsom signed AB 378, Building a Better Early Childcare and Education System Act. This allowed 40,000 childcare providers to vote to become a union, and 97% of California daycare providers voted yes to unionize. This win gave family daycare providers the right to negotiate with the state for improvements to the early childhood education system. Our first contract agreement was a $1 billion agreement, and we deserve more. I am here to ask all providers who are not union members to join us now. You should join the union because there is so much more we deserve and so much more that needs to be changed, fixed, and corrected, such as a rate reform, meaning we should get paid on the true cost of care now. Reimbursements providers based on enrollment and not attendance, eliminating parent fees permanently. And let's not forget about the retirement fund. We need every provider in California to join our union, Childcare Providers United. Join us now when we have actions at the state capitol so we can show how united and powerful we truly are. When providers are organized and we use our collective power, we can force all decision makers from the governors to legislators to wealthy corporations to pay more attention. We need providers to join and use their voices on the steps on the state capitol so that decision makers can see us and hear us. When we go to Sacramento, we make our presence known. When we fight, we win. We make things happen by working together and being united. So far, we have won things such as our first COVID agreement, 14 paid days. Our second COVID agreement, 16 paid days. Funds for mental health, supplemental pay, our $40 million training fund, infrastructure block grant, and family childcare providers had never been included in this grant before. And of course, our healthcare fund. This is why when we unionize and why we fight for our rights and the benefits we deserve. We need you to join us and stand side by side with our demanding change. We're going to drop the link on the chat. Join the CCPU. Únete a la CCPU. Thank you.
Great. Thank you so much. Really appreciate that. And now we're moving into the question and answer portion of our webinar. So we see lots of questions coming in via the chat. Thank you guys so much, or via the question and answer box. And then we also received hundreds of questions that you guys submitted when you registered. So I'm going to go through quite a few questions today and answer as many as we can that are live. I think you'll see that there's a lot of, we're seeing a lot of the same type of questions. So I'm hoping that we can get to the majority of them. So I'm going to start off with a question that we got from Linda. And this is a very common question that we're getting, which is, does the plan cover dental, tooth implants, or tooth bone replacement? So just in general, the plan is not covering any dental expenses, whether that be premium or out-of-pocket expenses in the current plan year. The trustees are looking at ways that they can enhance this program in the future, and this is one of the things that they're taking into consideration. But for the current plan year, dental and vision are not covered benefits under this program. We also got a question from Diana. And she wanted to know about, how do I get reimbursed for healthcare premiums that I've already paid in the first quarter? This is a really common question. We're getting it a lot now because you're starting to see a lot of applications being approved, and now they want to get reimbursed for the expenses that they've actually put out in the first quarter of this year. So the first thing to be reimbursed is you have to be approved for the program. You have to apply and you have to be approved. Once you are approved and you meet the eligibility criteria, you would need to submit a reimbursement request. And so those are forms that you can fill out on our website. You can submit it to, the team is putting that link into the chat right now, so you can access it quickly, but you can submit it to it via online, you can fax it, you can mail it. We also have an app. So for those of you who have got your debit cards and you'll have access to the app, you can actually log in and you can take a picture of the expense that you're trying to reimburse, and you can submit it via the app. It is a secured app. So for those of you who have asked questions about protected health information or PII, protected or personally identifying information, all those sites are protected, so you can feel confident in putting your information in those websites. Once you submit it, you will be able to see in the portal the claims that you've actually submitted and the status of those claims. So whether we approve them, whether we ask for more information because maybe we didn't get all the information we needed to be able to process it successfully, we will ask for that information, and we would that website, that portal is your conduit to know where your claims are and when the next payment will be issued. In addition to that, those individuals who actually get a debit card can actually use that debit card and swipe it. So for instance, if you happen to be at the pharmacy and you'd like to pay for your prescriptions and it's a copay of $10 or $15 or even $50, you can absolutely swipe your card and you can take a picture of your receipt and upload it to the app. So there's a lot of different ways to get reimbursed and to utilize these benefits. Okay, let's see. The next question I had was from Elsa. Oh, this is a really good question. So Elsa's asking, what would happen if my medical insurance coverage that I currently have gets terminated due to my new income? Does the CCPU Health Care Fund help me regardless? And what do I need to provide to you? This is a really good question. And we're at a point right now where the state of California is doing a lot of different Medi-Cal redeterminations. And so if you're in a situation where Medi-Cal may redetermine you based on your income and say that you are no longer eligible for Medi-Cal, they do a really, really good job of facilitating getting you coverage in Covered California. That would be the next step, would be Covered California. And they've done a really good job of creating that warm transfer to Cover California so that you can get covered. Once you have your new plan, whatever that you choose, we hope that you choose a silver HMO so that you can participate in the program. But you could also, there might be a situation where you are able to get on an employer-sponsored coverage. Maybe you're eligible for Medicare. So there's a lot of situations in which a provider might change health insurance plans. And as long as it's one of the qualified health plans that we talked about today, that's the Medicare, the Medicaid, we call it Medi-Cal in California, a Covered California plan, all those listing of plans that we have, as long as you're on those plans, your benefits will continue. Your benefits might be slightly different though. So for example, if you're currently on Medi-Cal, you get that $100 reimbursable expense every month. If you move into a Covered California plan, the benefits are different. That permissible expense is no longer available to you, but you have other buckets that are available to you. So we would help pay for your premium, and we would also pay for any out-of-pocket expenses. And those limits are listed on our website. We also talked about them today. So it's a great benefit, and we would help facilitate you moving from a Medi-Cal plan into a Covered California plan or any qualified health plan, and we would adjust your benefits. What we would need from you, to be really specific, is we would need you to contact us and let us know that you're making a change, what the effective date of that change is. It's usually going to be the first of a month, and then your premium, proof of coverage. We need to see proof of coverage just like when you initially applied for the program. So there's a lot of help. We can help you through that. If you have any questions, give us a call, send us an email. We're happy to go through it with you and help you through the process. In addition, if you want more help in selecting a healthcare plan through Covered California, we have a list of 7 brokers that would be happy to help you make a good choice for your family, for you and your family. So we definitely encourage you to go to our website, and if you need help selecting a health plan, to contact one of those brokers. Okay, let's see. The next one we have on here is from Arlene. And I think, Arlene, you've said a couple other questions in the Q&A box, which is great. So really appreciate you participating today. You've asked, can we pay for things not covered by insurance, like dermatologists, acne treatments? This is a common question that we're getting. I really appreciate you asking it. So this particular program works with your medical insurance, right? So it covers for what your medical insurance does not cover. So for instance, if you're going in and you're having a procedure done and they say you have a $250 deductible, because that procedure is covered, and there's a deductible that's attached to it, we would pay for that $250 deductible, that out-of-pocket expense that we have. Conversely, if you decided to go and have a treatment that's not covered by your insurance, we would not cover that cost. It has to be included in your health insurance benefits for us to be able to cover any costs that might be associated with any procedure that you might have. So it needs to be covered under your health insurance for us to cover it. Okay. Let's see what else we have in here. This is another good one. This is from Sylvia. She says, I already have health insurance outside. Can you guys cover it? Or are you guys offering health insurance? So we want to reinforce this a couple different times. You heard our chairman Horace mention this earlier today. This is not a health plan. This is not health insurance. This is a reimbursement plan. So we are not offering health insurance. Let's be super clear. This is not health insurance. This is a reimbursement program. So in the program today, we talked about all the different qualified health plans that are able to participate in this particular program. And so if you had a health insurance plan, Sylvia, that is one of those qualified health plans and you met eligibility for everything else, we would absolutely encourage you to apply for this program. We think there's benefits that are here that you could access. So as long as it's a qualified health plan, we would cover you. If you aren't sure if your plan is a qualified health plan, give us a call or send us an email and we're happy to help you with that. No problem at all. Right. Let's see what else we have here. Sonia, where can we find the application for reimbursement? So there's a couple different things that I want to make sure that that we're clear. There's the application for the fund, and then there's the application or the request for reimbursement, two different forms and two different things that you would utilize them for. So to access an application, you can actually do your application online, or you can go to our website and you can request an application. You can also send us an email, or you can call us and say you'd like to have a paper application, and we'd be happy to send one to you. As far as the reimbursement forms, those reimbursement forms are right on our website. The team's going to put a link in the chat to both the application and the request for reimbursement. So for any providers that are in a situation where you'd like to apply for the fund, we'd love it if you did. Or if you have already applied and you'd like to access your benefits, that reimbursement request form is right there and you can access it. Okay. The last one I have on, oh no, there's more here. Catherine is asking, if you don't use all the money on your Visa card in 2023, will the remaining balance roll over to 2024? Great question. And the really unfiltered answer is no. These benefits are for the current plan year, and no benefits that are unused will roll over to the next plan year. Okay. I think this is Corrine. And Corrine asked, how do I use the debit card and how do I apply for reimbursement? So we're starting to see people that are actually getting their debit cards, they're asking for reimbursement. So the team is going to put into the chat here two things. First is the FAQs about the debit card. It's really important. This is a new feature for all of our providers and for this program. So we want to make sure that you guys have access to reference material and know how to use your debit card. So there's an FAQ, or frequently asked questions, on our website. And then we also have a user guide. The team is going to put both of those links into the chat so that you guys can access those directly, both of them on our website, and are available for anybody that would like to utilize them. And now I'm going to go to the open questions that we have in the chat. We have a lot in here. This is great. I really appreciate you guys participating. So let me go up to the top here and see if we can't get to where we're going. So Wendy is asking, if we are paying for prescriptions with a debit card, do we swipe and the funds will be approved for that purchase and then upload the receipt? How does that work? Great question, Wendy. And that's exactly how it works. So if you use your debit card at the pharmacy, you would swipe your card and then you could take a picture of your receipt and you could upload that receipt right there on the app. Or you could take a picture of that receipt and you could log into the portal and you could upload that receipt. And that should work without any issues. It says, so this is from Keisha. oops, I just lost it here. Keisha, it says, am I able to pay for future expenses, or do you only upload the funds after I've requested it? So what happens is for the debit cards that when you become eligible, we load the $87.50 onto your card if that's the plan you have. If you have a Medi-Cal plan and you only have permissible expenses, we'd load that on a monthly basis. That $100 would replenish and build every month. And then premiums are done on a quarterly basis. So once we have your premium expense and we know what it is on a monthly basis, that's why we're asking for your premium bills. So we can allocate those funds to your debit card. So once we have that information, the premiums will be funded on a quarterly basis. So once you achieve eligibility for the next quarter, we would put those funds in there and you would be able to have access to them. Okay, let's see. Sammy is asking, hi, I'm a dependent through my spouse employer health plan. Can we talk more about what I'm eligible through the fund and when can I use the debit card? Sure. So spouse coverage, employer sponsored coverage is one of our QHPs. So you 100% would be able to apply. And as long as you have met the other eligibility requirement, we'd be able to look at you and hopefully be able to approve you. But employer coverage is absolutely one of our QHPs. And once you're approved, once you apply and once you're approved, then a debit card would be issued to you and you'd be able to use that debit card as we've been talking about previously, being able to swipe it or being able to submit reimbursements online for those requests to get reimbursed. Okay. Let's see here. Can we set up our debit card as auto pay for our monthly insurance? It's a really good question. And I'm so glad that you asked it. I think it's Sarah. So as I was just mentioning before, that initial payment needs to be confirmed. So we need to have a copy of your billing statement so we can see how much it needs to be allocated for your premium. Once we know that, and as I mentioned before, once you achieve eligibility, we will pre-fund that in a quarter in advance. So the short answer to your question is yes. I will qualify that with as long as we have been able to verify your first payment with a proof of your coverage and also your billing statement so we can see what your premium is. So you would be able to use your debit card if your insurance carrier accept it. Okay, let's see here. Christina is asking, is there any plans to convert these cards to FSA accounts? No, this is not an FSA account. It's not a RISA plan. And so there is no discussions about converting this to a flexible spending account. It's not an employer sponsored plan. And those are typically used for pre-tax deductions. And so that we wouldn't qualify for that in this particular program. It's a good question though. An anonymous attendee is asking, how soon can we use the debit card after we are approved? As soon as you receive the debit card and you activate it, you 100% can use it right then. Wendy is asking, for the first quarter expenses that we submit request reimbursements for, will the money be put on the debit card or will we receive a check? Good question. What will happen for your expenses if you've already paid for them? We will actually write you a check and you would get that check. We would not put it back on the debit card. We would reduce your debit card balance by the amount that we reimbursed you for. So for instance, if you had paid your monthly premium of $300, then we would, and you had already paid it, we would send you a check for $300. As long as obviously it was a qualified expense and you know everything was approved, you would get that check. Only when you swipe your card is when it's automatically deducted. Otherwise, you'd have to submit a request. Okay, let's see. Iridira, I'm sorry if I said your name incorrectly, I apologize. You're asking, I'm on my husband's insurance policy. Can I use this fund to pay our monthly health deductions from his paycheck? So if you are on your spouse's plan for premium reimbursement, we will reimburse you up to $100 per month for for your coverage through your spouse's plan. And so you would need to submit that reimbursement to us and we would reimburse that for you. Let's see here. I'll leave the Spanish ones to the interpreters. Another anonymous attendee says they weren't able to join earlier and they have access to this recording later. Absolutely. Everybody that is attending this webinar today will get an email from us with a link to the recording. So you will absolutely have it, and it will also be posted on our website as quickly as possible. So you will have access immediately. Okay, I seem to have missed a bunch of people here. Okay. What if you, this is from Susie, what if you lose your subsidized family, but have an opening and aren't able to find another subsidized family? I'm not sure, Susie, that I'm the best person to answer this question. I don't know if any of our trustees are on the line that and could answer this question. This is kind of out of my area of expertise.
Susie, it'd be my pleasure to answer that. So Susie, what happens is you were qualified in the first quarter because you had subsidy children. And then the second quarter, you're questionable eligibility because you did not have the one child out of the 3 months. So you are then gifted that one time. So it's your job to go through and get a single child for the second or the third quarter, so you can be re-qualified. So again, if you're qualified initially, and to keep your qualification, as long as you have one subsidized child for 1 month of the 3 months, you continue your coverage. If for some sake and reason in that second quarter, you lose your child, but you have 1 month, you're still eligible. But if you have 0 months out of that second quarter, you're gifted a gift of continuance. Thank you.
Thank you, Mr. Chair. We have a question here from Swapna. Again, I apologize if I'm saying your name incorrectly. She said, my application for a healthcare fund is still in progress. How can I get my card to pay out of pocket? As soon as your application is approved, you will get an email and a letter from us that will allow you to access the card. As soon as we give that approval, we request your debit card. The debit card company says it takes 7 to 10 days to get your debit card. We are seeing that happening much faster than that. So as soon as we approve it, you should be getting a card very quickly, and you would get notified of when we approve you through an email and through the online portal. So I would encourage you to take a look. And if you have any questions or concerns about your application, I would highly encourage you to give us a call or to send us an email, because we're happy to look into it for you. Okay, let's see what else. It says, oh, here's a question. I'm sorry, it went by, here it is. Adriana, does my husband qualify for these funds? He is my helper. So the way that it works is it's if you're on the same license, right? We only allow in the current plan year, we only allow one person per license to come in, and that's a first come, first served basis. The other way that your husband might be eligible is if he is receiving payments directly for working with a subsidized child. If you both are individually receiving payments, then we could take a look at that. But if it's directly to you and you are the one receiving payments, then it would be your eligibility.
Bobby, can I include on this one?
Yeah, please.
My brothers and sisters, as we embark in this beautiful benefit that we received of having healthcare, this is unprecedented. This is a first. Mind you, it's a huge victory for us. And as we continue to grow and unite and make our union strong, to have the voice at the table, we are only going to be able to achieve more. So once again, the more we do, the better off our programs and our process and resources will get. So at this current time, we're limited, so we can only do what we can do at the moment. But rest assured, the bigger we get, the more providers that step on, the more activities we get, the more everything that we do, it's only going to be enriched. So thank you, Bobby. Thank you, everyone.
Yes, thank you. There was a question that came up here from Diane, Is the welcome letter different than the debit card? Yes, yes, and you need both. So what happens is you should get the welcome letter first, and the welcome letter has your access information. It tells you your username and password to be able to access the debit card portal and be able to log in. And then once you get your debit card, that's how you do it. You'll activate the card. That's how you do it. So the two come together, and they're sent separately on purpose. So the welcome letter will have your username and password. When you get your debit card, you put the two together and you can log in and activate your card. That's how that works. Okay. There's a question here. I'm not sure I'm answering. Why do medical recipients get so much more coverage than other insurance? And is there a way to get more items covered like medical? I'm not sure, Anonymous, I'm not sure that I'm understanding your question. So if you could be a little bit more specific, I'd be happy to answer that question for you. Laura is asking, can you state the quarters again? So for first quarter eligibility, so if you had worked with a subsidized child and you wanted to apply for Q1, we're still accepting applications for the first quarter of 2023. You must have worked with a subsidized child and been paid 3 of 6 months between April and September of 2022. That is the eligibility period for Q1 of 2023. And if you needed to roll forward into Q2, that eligibility period is July through December of 2022. And again, the criteria is receiving payment 3 of those 6 months for working with a subsidized child. Okay. Let's see here. Fanny, you have a question here. I've have my health insurance through my husband. They take the premiums directly from his paycheck. How can I get reimbursed for that? As I mentioned before, all you need to do is submit a reimbursement request. We will reimburse you up to $100 per month for employer-sponsored coverage. Let's see. And Miss Dougherty, I'm sorry, I can't pronounce your first name, and you asked a question previously. If I can deduct $100 a month from my regular health coverage deduction, how do I proceed to claim that? So it's the same process. If you want to make any reimbursement request, you would submit a reimbursement request form, or you can go online to the portal and request it through there and upload a copy of your expense receipt so that we can look at it and approve that payment. So you just do it through the portal, or you can do it, download the form and submit it via fax or mail, however you choose to do it. But you'd have to request it. Okay, let's see here. So here's another one from an anonymous attendee. If we have a surgery that is approved, oops, it moved real quick here. Do we get reimbursed the amount up to the amount allowed on our debit card, or can we get the money ahead of time since the outstanding amount would be too much to reimburse? Okay, so here's the thing about copays and deductibles. And a lot of insurance carriers will tell you in advance, like if you're going to go have a procedure and they're going to say it's going to cost you, it's $15,000, but your copay is $500, or your copay is $300, or whatever the amount is. If they give you that information and you can submit it to us, we will reimburse you for that. So it's really an explanation of benefits, and a lot of medical insurance provide that ahead of time. So we would actually be able to help you with that. Okay, let's see. If I pay my premium per year, how is it going to receive my reimbursement? Raquel, I'm not quite sure that I understand the question. If you pay your premium in advance, I don't know that, I'm assuming from your question that's what you mean. If you pay your premium in advance, it doesn't really change anything. As long as you're eligible and you meet the eligibility criteria and you've submitted your proof of coverage and we've approved you, we would need a copy of the bill, the premium bill. And as long as you have eligibility during the period of coverage, we would reimburse you for that premium amount. Depending on the qualified health plan, the amount might be capped. So if it was an employer-sponsored plan, it would be capped at that $100 per month. And so it just depends on what qualified health plan you're on. But as long as you have a receipt and you have coverage and you're qualified for the plan, we would reimburse you for that, up to the amount for that. Let's see. It's a lot of in Spanish. Diana, you asked another question. Do we need to upload a receipt every time we use the card? Okay, so for premium bill, I'm going to say yes, because that's a premium copy of the bill. We'll need it to be able to confirm your premium amount. However, not every expense will require you to upload something, and the system will tell you. So if there's a receipt that's requested, the system will tell you. If you used your debit card and you swiped it, the system will alert you that you need to upload a receipt, and you have 10 days to do it. So not everyone will, not everything is required to have a receipt, but those that do will ping you for it, and will prompt you to upload a receipt. Okay. Someone says I was approved almost 2 weeks ago, and I'm wondering how long before I received the card. Again, the card company, the debit card company, is saying 7 to 10 days. So we're at the mercy of the U.S. Postal Service. So that's, and as I said before, we have been experiencing those going out quicker or being received quicker. But depending on where you live and how the Postal Service works in your area, it could be shorter or longer depending on those criteria. It's asking in the application for a health code fund ID. I'm not quite sure where you are, Swapna. If you're talking about in the portal for the debit card, that is the U number that would be on your welcome letter. If you have any concerns or you're having any issues with that, just give us a ping, and we'll see what we can do to help you out with that. Let's see. Araceli is asking, can I give my debit card information to my health insurance so they can collect my premium? Yes, as I mentioned before, once we have validated what your premium is, we need to know it for that first month, so we know how much your premium is, and then we'll fund your card, and then you can actually set it up, and the card can be debited. I will caution you that if you lose eligibility for whatever reason, that you might be in a precarious situation. But to answer your question straight up, yes, you'd be able to do that. There's another one in here that says, can I use the benefits to pay for expensive medicine that my insurance does not cover, or for acupuncture and chiropractic? So as I mentioned before, this particular plan works with your insurance carrier. So if your health insurance plan does not cover a procedure, then we would not reimburse you for any out-of-pocket that you spent on that. So it has to be covered by your insurance. And once the insurance pays their part, and there's a balance due, we would help you with any balance due that would be due to the insurance company. So it works with your insurance company, not in lieu of your insurance company. Let's see here. This is from Olga, is there a cost to the provider to use or to be enrolled in this? There is not, Olga. There is no cost to you at all. This is an extremely rich benefit that this union has negotiated on your behalf. And if you qualify for this program, there's some really, really good benefits. So there is no cost to it. And I would absolutely encourage you to apply if you're working with the subsidized children and you have a qualified health plan that would make you eligible for this program. We definitely want to give these benefits to those people who have earned them. Here's another question. What if my doctor prescribes vitamins, but when I go to the pharmacy, they say it's not covered? I'm going to again just reemphasize the same thing. If your doctor is prescribing something and you go to their pharmacy and they say that you have a copay, we would absolutely take care of that copay for you, but it would be the copay. If your insurance is saying they're not covering it, then we would not cover it either. So it's really important that we work with your insurance company to make sure that whatever expenses that you're requesting reimbursement for are actually covered medical expenses from your insurance carrier. Susie's asking again, is there a monthly fee? There is no monthly fee. No monthly fee at all. Let's see here. Arlene is asking, once we have the card and we pay with it for our out-of-pocket, do we need to provide receipts, or how do you track it? So again, Arlene, as I mentioned before, if you use your card and you swipe it, the system will tell you when a receipt is required. I would just go on a rule of thumb that every expense is going to need a receipt. It's always better to have a receipt than have to go try to find it after the fact. So I would encourage everyone, if you have a receipt, to upload it as soon as you have it. That makes it a lot easier, and then you don't have to go look for it. So not everything will need one, but I think it's just a good practice to make sure that you upload a receipt. Sonia is asking, how will we be reimbursed by check? So initially, yes, you'll be reimbursed by check, and shortly in the next couple of weeks, we'll add the functionality for you to have it direct deposited into your account. So if you choose to not want a check and to have your funds, your reimbursements go directly into your account, that functionality will be coming up in the next couple of weeks, and you can go in and set that up in the portal. Let's see here. Here's a real good question by Nahid. I think I said that correctly. How long does it take to get reimbursed? We are trying to reimburse as quickly as possible. We are looking at, we do weekly runs, so we do our processing every week. So our goal is to have everything we have in queue every week paid. Depending on the volume, that may not be something that we can achieve, but we're looking for very quick turnaround time, very quick turnaround. So 7 to 10 days. We have up to 30 days, but we would prefer to do it much quicker and faster, and that is what our goal is. Let's see. Diana, it sounds like you might be having some questions about the actual website. So why don't we take your name? I'll have the team take your name, and we can have one of our service center people give you a call and help you through the issue that you're having in the site. Okay, let's see here. Medical. So here's one from Maria. She says, what if my medical does not cover the cost of glasses? Can I use that, for example, with a prescription for glasses to purchase them at Costco? The answer is no. As I've been saying before, if your medical insurance doesn't cover it, then we would not cover it either. So this is very typical that you can go get an eye exam, and that's covered for your medical insurance. But if you need glasses, those glasses themselves are not covered. So that would not be something that we would cover here. Even though there is a prescription for your glasses, it's not covered by your medical insurance, and so we would not cover it either. Let's see here. It says here, this is from Simon. Sorry if I said your name incorrectly. I use in the pharmacy the card I got, and for my copay at the doctor's office, I have to send your receipt, or is it okay? Okay, as I mentioned before, the system will tell you when you need to upload a receipt. It's a good practice to always upload a receipt. So that would be my suggestion and my recommendation to anybody that's on this webinar seeking advice. Always just upload the receipt. It'll just be easier for everyone, and then you don't have to know and pay, go look for it later. So I would definitely recommend always uploading the receipt. Let's see here. Mercy, I see that you're asking for a call back. We'll take that information and give you a call back. Yep, we sure can. So Mercy is asking for some help. So we'll get somebody to give you a call. Christina is asking, my insurance covers, oops, where'd it go here? Christina is asking, my insurance covers mental health. Can I use my card for a copayment? Yes. If you're many insurance plans that give you up to, some like 10 to 15 visits per year for mental health. And they have a copay. And if that's the case here, you would just submit your explanation of benefits with your copay amount, and we would cover that for you. Yes, great question. Let's see. I think I've already talked about how long it takes for reimbursements. Yes, Swapna, you're asking, without an application approved, we cannot reimburse our expenses. Yes, you have to have approved application. Absolutely. You have to apply before you can get benefits. So yes, yes. Laura, you said you have a question about eligibility. So let me go, maybe I can help clarify this for you. So we have initial eligibility, which is that period of time that I was talking about. That's 3 of 6 months. So for Q1 of 2023, if you to be eligible for Q1 of 2023, you need to have received payment for working with a subsidized child between April and September of 2022. So 3 of 6 months of payments for working with a subsidized child. If you were not eligible, you didn't meet that criteria, then Q2's eligibility goes from July to December. So again, the criteria is 3 of 6. So 3 of those 6 months you'd need to have a payment for working with a subsidized child. So that's initial eligibility for Q1 and Q2. But once you're in the program and you're approved with your initial eligibility, there's ongoing eligibility. And that's what Horace was referring to previously, which is that 1 of 3. So if you meet eligibility for Q1, you've had 3 payments out of 6 between April and September. Great, you met that initial eligibility. To continue your eligibility into Q2, you would need to receive 1 payment out of 3 months between October and December of 2022. And that would be your ongoing eligibility. And if for some reason that you didn't meet that eligibility criteria, you would go into a grace period. So the trustees have been very gracious in allowing providers that don't meet continuing eligibility 1 quarter of grace period. So they would cover that and hope that you would regain eligibility for the following quarter. So that's kind of how it works. I hope that helps. And if you have any other questions about that, let us know. But that's how it goes. A continuing eligibility is by quarter, and you need to be paid 1 of 3 months, and the parameters of those quarters we can share if you guys need them. It's also on our website. Okay, let's see. Angela's asking, how much do you receive on the card? It depends on what qualified health plan you have. So it's not a blanket statement. It's not a blanket benefit. It depends on your specific situation, would be the amount of benefits that you'd be eligible for. Wendy, I see your note there. Let's take a note about your welcome letter. It's really hard to use your card if you don't have your login information. So let's see if we can get you a welcome letter there. Let's see. I don't know what time we're over time. For those that are still submitting questions, please continue to submit your questions. We will get back and answer all of your questions. So we don't want you to think that you're going to go without getting answers to any of the questions you have. Really appreciate you coming today. Horace, did you want to close this out? I'm going to assume that he is not available to do that. So I'm going to say thank you to all of our participants. Thank you to all the providers that were on the call today. I really appreciate it. And we hope you have a great weekend. Thanks so much.